Hello, everyone. This is another Freedom to Feel conversation, and my guest today is Dr. Samuel Mann. So I'll introduce him briefly, as I usually do, and then I'll ask him the question. So Samuel is a physician, researcher, professor of clinical medicine at NY Presbyterian Hospital, Weill Cornell Medical College. But he's also the author of Hidden Within Us, a radical new understanding of the body-mind connection. And he also have written other books, Healing Hypertension and Hypertension and You. So 3 books. So this is my brief introduction. For the full biography about Sam, look at the end of this video. It will be there. So in your own words, who is Sam?
Sam is somebody who found his way into medicine and hypertension in particular, which has been a fascinating specialty. And between a mixture of my own personal life and my professional life, it has merged into a very broad interest in the mind-body connection. And most of my medical publications are about hypertension and very medically based. And most of my work has been published in peer-reviewed scientific journals. But I also became very interested in the mind-body connection along the way. And that has been a fascinating trip because hypertension was once considered the quintessential mind-body disorder. And decades of research were done. And I have to say, after decades of research, they did not find that what they were thinking was true. They could not prove a mind-body connection, and they could not prove any effective relaxation techniques, stress reduction techniques. And yes, briefly, our blood pressure rises in response to emotion, anger, anxiety. In everybody, that's not hypertension. And relaxation techniques lower it briefly in everybody. But long-standing, 90% of hypertension is not mind-body. But where it is, I found it's very different. And more important, it's related to, has impact on treatment. And it's also related to a lot of medical conditions that there's been a lot of mind-body research that has yielded very little, to the surprise and disappointment of so many. And it relates to chronic fatigue syndrome, which in the medical field, we have no idea the cause and treatment. Chronic pain syndromes, migraine, autoimmune disorders, and others, where there is to some extent a mind-body connection, but it is different from what the decades of research have been trying to prove and couldn't.
Right. How fascinating. I usually see clearly, from my perspective, these unknown diagnoses and trying to find cure for so many diseases, and science cannot do it, even for cancer. That surprises me and so many people. And then when I hear topics like this, it's repressed emotions and how what they do to the body and what the consequences are long term. That kind of speaks to me as the invisible world, like this, this whole reality. We're not really in touch most of the time. Most of us human beings, we're kind of, it's there, we know are there. Like thoughts, that's completely invisible. That's inner world kind of reality that's happening all the time and changing all the time. But most of us are not aware of it. I love the way you talk about this awareness. I wrote it down here. You said something that caught my attention. I have so many pages. You said, I believe this understanding can open the door to awareness and trust in the wisdom of our conscious mind, that in allowing those emotions into awareness, it is opening the door to healing. So talk to me about the wisdom, and why does the subconscious, or the unconscious, kind of try to spare us in a way from challenging emotions and pain?
Right. I'll start out by just being very clear about what repressing emotion is, because a lot of people have a misconception. They think that repressing emotion is, well, this feels terrible, let me avoid it, let me think of other things and not pay attention to it. That's not repression. That you're conscious of the emotion and you're doing your best to avoid it. And there's nothing wrong with that because we have to function.
Yeah.
Repressing
Yeah.
emotion is something very different where we don't even realize we are repressing it. And I'll give an example. It's in the book of a patient that really opened my eyes. And one type of hypertension in particular has been a total mystery. People who get sudden bouts of severe blood pressure elevation out of nowhere.
Mm,
They're not under stress. They feel fine. All of a sudden, they have a terrific headache and their pressure can be 220 over 120. Go
right.
to the emergency room, eases up after hours, only to happen again and again and again. Medical science has no idea what causes it, no
Mm,
idea how to treat it. In that context, I was seeing a man who came to me because I'm a hypertension specialist,
yeah.
and I take a psychosocial history. Things are good. He's in his 60s, he's married, family, work, money. He has no stress. Life is wonderful. And he
Right.
keeps on getting these attacks. And at this point, I was already suspecting a mind body connection. I
Mm,
asked further history, and the one thing that popped up, gigantic thing, the man was a Holocaust survivor.
mm, right. Ah,
And I
yeah.
wondered, now this disorder is driven by the sympathetic nervous system, our fight or flight reflex, and something like the Holocaust, what's
Yeah.
going on here? And I asked him, do you think it might be related to that horrible
Mm,
that
yeah.
you lived through?
Yeah.
And he said, no. He said, that was decades ago.
Mm,
Didn't affect me emotionally.
ah,
And I thought, wow,
right.
that's the unconscious mind keeping it from his awareness. He's
Yeah.
not struggling to keep it out of awareness. He
Yeah.
never felt it.
Right.
And when we talk about repression by the unconscious mind,
Mm, yeah.
it's a gift.
Yeah. Yeah.
It's a gift of evolution that gave us the ability to not feel that which could overwhelm us emotionally.
Yeah.
This man survived by not feeling and did well. And
Yeah.
here he is with this unexplained disorder that nobody else can explain. And I found that other
Mm,
people with this particular kind of hypertension called paroxysmal
right.
hypertension, everyone had a story, combination of a story and the absence of emotion related to the
Mm,
severe stress or trauma.
wow.
And even more subtle than trauma, I mean, I've seen this in patients who were immigrants to this country. They came here at the age of 20. They had no money, no language. They had to work. They worked 16 hours a day, 7 days a week, raised a family, didn't take a vacation. I'm not an immigrant. I never realized how tough it is.
Yeah.
And did you ever feel anxious or overwhelmed? No.
Mm,
That's the gift of repression. And people think repression is a psychological disorder. No, it is a gift that our
mm.
unconscious mind protects us.
Wow, that's amazing, and it really resonates true to me for some reason when I read that, kind of yeah, of course, yeah, 'cause I have had the experience myself, going through a lot of traumas in childhood, and I remember doing, like, healing energy or massage therapy and kind of, having the body respond in a very powerful way, would shake and then, sweat and nervousness, anxiety, but there were no thoughts, no memories of anything, so something clearly was happening.
Yeah, and I want to be clear. People talk about repressed memories,
Yeah.
and that's very controversial. Are they real, or are does a psychologist suggestive patients suggest it? Um, this is not dealing with the absence of memory. They remember it, but
Yeah.
it's the emotion related to it that's
Yeah.
just blocked off
Right.
and served them at a time when they couldn't handle it. Children who go
Mm.
through trauma, sudden death of a parent if a child is 12 years old, needs to repress, and
Yeah.
it's a gift. Um,
Yeah. Wow.
at the time it's served, and they're not feeling anxious or depressed. That's the amazing thing. They don't
Right.
feel any of that, but years or even
Mhm.
decades later, they have this or that ailment that nobody can explain.
Right.
And A physician talking to that patient is not going to suspect a mind-body connection because he's not anxious, he's not depressed.
Right.
And psychologists cannot write about the mind-body connection related to repressed emotions because they're not going to go to a psychologist. They're not depressed, they're not anxious.
Right.
Psychologists can't write about them.
Wow. So it is a gift, but not a gift at the same time. It is
Right.
paradoxically.
And when you think about it logically, which is more likely to affect you physically? Being upset about stress,
Yeah.
or, and that comes and goes, or a powerful emotion that one does not feel, but that persists hidden within.
Yeah.
We would swear we do not harbor that emotion, but it's there. And
Mm,
studies show sympathetic nervous system elevated in these conditions, and nobody to this day can explain, well, why is their sympathetic nervous system tone increased?
mm,
So these are powerful emotions that linger hidden for decades.
right.
Now, which would be more logical a candidate for the mind body disorder? Stress yesterday or something powerful that sits within us hidden for years and decades? So
Mm,
it serves us well, but it's still there.
right. And I mean, I have to ask the question now. I know I could have waited, but I'll ask. So, what's the solution? What do we do,
I
Sam?
knew you were going to ask that.
Yeah.
Well, what is the solution? There are a few solutions. And first of all, this is brand new thinking.
Yeah.
So there's very little in the literature to talk about this.
Mm,
And this is a new frontier. And there are a few approaches to this. And I don't mean to say that every condition is caused by repressed
right.
emotions in
Right.
every patient. Depends on the disorder.
Yeah.
In some, it's a minority of patients, in some, a majority. When I think of chronic fatigue syndrome, where nobody knows the cause, nobody has a treatment, almost every chronic fatigue patient that I've seen has a story. And by a story,
Mm,
I
yeah.
mean a combination of severe stress or trauma and the absence of emotion related to it. So, what is the solution? The obvious question then is getting in touch with the emotion a solution?
Yeah.
And my experience with patients tells me yes, but not for everybody.
Mm,
Would I ask the
yeah.
Holocaust survivor to get in touch with his feelings?
Yeah.
No, I wouldn't.
Yeah.
Um, Others who have been through severe stress, which they had to block off the emotion at the time, if they can understand it and get in touch with the emotion, they can heal and heal quickly if they get in touch with that emotion. And that varies from patient to patient. So if you are listening to this and thinking about it, this may be the first time it ever occurred to you
Yeah.
that there might be a link to, gee, that happened to me 20 years ago and it was awful and I was lucky, I'm all right.
Yeah.
But oh my God. And that can lead to healing. And there are barriers to that. I can get into that. But what about the
Yeah.
Holocaust survivor? What about the people with overwhelming
Yeah.
trauma that could not and still cannot? And the answer is, well, the first step is to at least be aware of the link. The second step is this something I can get in touch with?
Yeah.
And I think the first words I would use is self trust.
Yeah.
Somebody has hidden this for decades.
Yeah.
And I bring up
Mm,
the possibility
yeah.
that barrier of decades is not going to collapse because I said a few words. That
Right.
barrier will remain. If emotions come up in response to, for the first time, considering that, then the chances are very good that you can handle that emotion.
Yeah.
Or your barrier, the gift of your repression by your unconscious mind is not going to break down because somebody said a few words. And I
Right.
think that is so important that if the emotion comes up, you can handle it. If the
Right.
emotion doesn't come up, do we do things to force the emotion up? First of all, there's no data, but second of all, no, I wouldn't do that. I
Yeah.
have to trust the patient.
Yeah.
If your life currently is in severe stress, it's not the time to get in touch with it. But if life is good, there is the option of getting in touch. And the most important thing is trust your unconscious. If you can't handle
Yeah.
it, it won't let you.
Ah, wow. That is incredible. What is the difference between the subconscious and the unconscious? Are they one and the same or somehow different?
My first answer is I don't know. What I think the difference is subconscious is sort of in between, in that there's more access to that emotion. If it's subconscious,
Yeah,
you have more access to it. And one could say that, yes, some of this emotion is in the subconscious and is more accessible.
yeah,
Um, the difference between subconscious and unconscious is, I think, a linguistic construct, but I don't think
yeah,
it's about the wiring within us. And
right,
I don't think we know what emotions we have that are in our unconscious versus subconscious. And
right.
so I don't think very strongly about those two realms.
Yeah. And another question I have is, it sounds to me like the solution for this problem, it's connected to the work of, let's see, psychology. So it's almost like something that you would refer to a psychologist to take care of. But it seems like you're doing that yourself as well. Are you actually having conversations with your clients about the unconscious, subconscious mind and content and hidden emotions, or do you refer them to a hypnotherapist? Would be the case too. I thought about it. It just came to me because I know how it kind of also helps us to not to be directly in touch with those powerful emotions, but at the same time, it gives us the almost like an illustration, like a dream-like kind of version of that, which facilitates the healing, from my understanding.
Right. Um, a couple of barriers. One, I do not refer right away to psychologists because if the emotions are repressed, there's a lot of resistance to
Yeah,
feeling them.
true.
And you're not going to go to a psychologist and in 2 sessions get in touch with things.
That's true.
And if it doesn't come up within weeks and months,
Yeah,
then are you really going to persist with it?
right.
So the discussion, I mean, people go to psychologists because they're aware of emotions, they're aware of
Yeah,
anger, and
yeah,
know that there's a lot of anger from childhood, and they're dealing with the
yeah,
emotion that's coming up. I'm
yeah.
talking about there's no emotion there. So
Mm,
going right away to a psychologist, and the studies show where it's repressed, it's difficult to get to. So
yeah,
psychotherapy, there's no track record yet, and I wouldn't recommend it to everybody.
right.
Um, so, what is the role then of psychotherapy? I think when the emotions come up, seeing a psychotherapist can be helpful in dealing with those emotions.
Yeah,
I think that's important.
yeah,
As far as what I say to patients, I had to learn how to talk to them.
yeah,
And there are a few points that I emphasize.
yeah.
And one is when you suggest to a patient that this is a mind body disorder, a lot of patients feel put down. You're telling them
Yeah,
they're crazy.
yeah,
One thing I want to say, this is the opposite of crazy. And
right.
one chapter in my book, I titled it, not a subsection in a chapter, about a patient, the best of the best.
Mm,
These are not crazy people. These are people who functioned despite what happened to them.
mm,
They're the best of the best.
yeah,
And um, I
yeah,
emphasize that their mind did exactly what they needed it to do at
mm,
the time.
mm,
It's not like they are avoiding. They needed to avoid. And
yeah,
they had the blessing of repression. And I would also say that genetically, evolution gave us the ability to repress. It's not
yeah,
clinical pathology, it's a gift.
right,
And the points that I make to a patient are your mind did exactly what it needed to do then.
right.
If their current life is a mess, I
Yeah,
wouldn't go there, but
yeah,
and I emphasize they are resilient
yeah,
and they can
yeah,
be proud of how they handled it. And it's
right.
interesting because when I look at books
Yeah,
on emotional resilience, I don't find the word repression in them.
yeah,
Repression
yeah,
is such an
true.
important part of resilience.
Yeah,
So I
uh,
emphasize Yes, it's mind body, but it's not psychopathology. Yes, there is a possibility for healing. And I listen to the patient. And often, right at the first visit, they get it.
They do. Yeah.
Um, I don't go
Wow.
toward hypnotherapy because there's no record of, well, is hypnotherapy safe in somebody who has repressed those emotions?
Mm,
Is
yeah.
it safe to sneak through that barrier with
Yeah.
hypnosis? I don't recommend it because we just
Yeah.
don't know, can that do harm? But when
Right.
the patient
Right.
understands it and feels the emotion come up, that's the first step of healing. And my message is, don't be afraid of it. If
Yeah.
the spouse is there,
Yeah.
I tell the spouse, don't stop the crying. If she's crying over what had happened, just
Yeah.
give her a hug and let her cry. This
Yeah.
is the healing. This is part of the healing. And patients recognize that. I don't have
Right.
to say anything further.
Yeah.
And that's the gift. But
Yeah.
again, it's not for every patient.
Right. It's true. What can I say? It's beautiful work what you do. I see compassion there. So you're looking deeper into the issue. It's not being discarded. So if you didn't find the solution, if you didn't see it, you just went deeper to just try to help them. That's such a beautiful.
Yeah. And again, it's that combination of severe stress, history of severe stress, not
Yeah.
necessarily trauma,
Yeah.
and the combination of that and it didn't affect me.
Yes.
And that's repression. And there are so many conditions. You can look at, well, as I said, chronic fatigue syndrome. The medical field has no idea what causes it. You can talk about autoimmune diseases.
Yeah. Yeah.
Um, we know the pathology. Uh, there's inflammation.
Yeah.
You measure inflammatory markers, they're increased. You measure sympathetic tone, it's increased. Nobody knows why.
Right.
Um, and you talk about treatment and immunosuppressant agents and all that. But if you ask any expert on inflammatory disease, well, what triggers it? What starts it? They have
Yeah.
no idea.
Yeah.
And again, not every patient, but I think a significant proportion in patients with autoimmune diseases, migraine. Studies show that in people, there are questionnaires that they give to patients in studies called Adverse Childhood Events
Yeah.
Survey, ACEs, Adverse Childhood Events. And when you look at migraine, people who have a history of adverse childhood events are more likely to have migraine at an earlier age and more severe migraine.
Right.
You look at
Wow.
some autoimmune diseases, more likely to have had adverse childhood events. There are
Yeah.
a number of faults in that questionnaire. I'm not crazy about it, but
Right.
it's objective and it's used. You look at chronic fatigue syndrome, big
Yeah.
difference, a big increase in the percentage who have a history of positive adverse childhood events, increase in sympathetic tone that nobody else explains, chronic pain syndromes. I don't know, uh, some remember the work of Dr. John Sarno, who talked about back pain.
Yeah.
And that was a bestseller. And I actually wrote a chapter in one of his books, but in talking about back pain and Dr. Sarno, here's I we're in sync on a lot of things, but there's an area where he and I are differ.
Right.
His approach was you look for a medical cause for back pain. If you can't find a medical cause for it, then it's probably related to repressed emotions. And I agree.
Mm, yeah.
Where we differ is that he's saying in the absence of a medical cause, it's repression. I am
Yeah.
saying repression is the cause
Mm,
of a number of medical conditions. So they have a medical diagnosis, but it is mind body in its origin.
wow. Um, I love the title of the book because it's so uh, inspiring when it comes to healing. But then I usually connect healing to spirituality. So, hidden within us, a radical new understanding of the body mind connection. Hidden within us. So, um, in a way it's not hidden then too. It's always there. It's in a way it's obvious that's there, but we are not ready to see it, or we don't I mean, with the intellectual mind, with the logical mind, we're not ready to see it or reveal it, or go back to it somehow and try to heal it, because we don't have that deeper understanding that you have now.
It wouldn't even occur to us the emotions are there. It would not occur.
Right.
And in fact, we would insist they're not there. What's he talking
Yes.
about?
Yes. Yeah. It definitely has been my experience of having the massage therapy and having some healing, energy healing work, and then the body really uh, responding in a very powerful way, but no memories, nothing there. I couldn't really find anything. So that makes sense now. I usually relate these things to spirituality because that has been my path. So I always see the work of consciousness, kind of this benevolent force or energy, essential, fundamental energy it is the substance of everything that exists. Do you have any understandings or any, let's say, any thoughts about what consciousness is, and what are your spiritual, let's say, views of yourself and life, Sam?
We have the capacity to love and capacity for spirituality that is way beyond what we consciously experience.
Right.
And in our life,
Yes. Yeah.
uh, we can live it more fully if we are in touch. I began my life completely shut down,
Yeah.
and it required an awakening. I think maybe if there were more spirituality and more awareness of that kind of emotion, maybe we would have a better world. Because the world right
Mm,
now is
yeah.
disastrous in so many ways. Um,
Yes.
um, yeah, we need to be unaware when we are in a situation that's overwhelming to us.
Yeah.
Um, People who are living through very difficult times, spirituality can really buttress their ability to march through that. Um,
Yeah.
Question is, how do you attain it? And
Yeah.
everybody has a different definition for
Mm,
spirituality, but
yes.
that's what makes us human, and that's the struggle of our life.
Yeah, and something that's very fundamental too, that a lot of us tend to ignore. That's what in a lot of spiritual teachings called ignorance, is that everything's connected. The foundation, the essence is one. So one reality, one essence, one substance for everything. This is the understandings that I have now because of my spiritual studies with Vedanta, which is a Hindu philosophy. But I started with Buddhism, of course, Judaism, so many other I studied everything, just trying to find out what was the truth. And in the end, every spiritual philosophy or teachings, they lead us to one realization, and that is that everything is connected, that the other is you, but in a different form. So that basic understanding would change everything. It would be the antidote of ignorance. So that's why I keep going back to spirituality, because I know scientists like yourself, uh, people that I highly admire because are seekers of truth, like spiritual people are, like myself. I have been always looking for the truth, as scientists are. But I guess the difference is that spiritual seekers like myself come to this direct realization, kind of direct knowledge of what this is all about, which we call life, which is connectivity, kindness, love, kind of treating the other the way I treat myself. So that is to me, well, I had to mention because it is something that's just so obvious to me now, that the main problem of humanity is basically ignorance, ignoring what is true, fundamental truth, the one that I just mentioned, that's the big one, that we are all connected. So do you have another comment to make about that, Sam?
Um, well, I'm getting off my
Yeah, I
area of
know.
comfort. Um,
Yeah.
it's interesting. On the one hand, I would still think, even with spirituality, we need repression at times
Mm, hmm.
to just to get through it.
Yeah,
Spirituality then plays a huge role in healing. Um, but I think repression, I still say it's a gift, but we don't want to live through our lives repressing everything.
right.
And spirituality is very helpful in healing from trauma. Um, and
Yeah,
spirituality is a battle. And how do we get to that is something that every generation struggles with. And we could go on and on about.
yeah.
I
True.
would say also, and the question is, what do I do with a patient where, yes, this is mind body, and no, they're just not getting it, or their life is not in a place where they can get in touch,
Yeah,
or it was massive trauma? Then what?
yeah,
And the interesting thing, and this is something that science has not studied, the patients with paroxysmal hypertension, the recurrent episodes of severe hypertension,
yeah.
ER visits, and all that. Um, and what's interesting is it's not like my understanding differs with any other understanding. There is no other understanding.
Mm,
And this understanding manifests as correct because people who get in touch are quickly cured of the disorder. What about the others who cannot? Their life is unstable. The
yeah.
trauma was just so massive, they can't. I figured, well, they're not depressed, they're not anxious, but it's about emotion that's rearing its head from deep within.
Mm,
What if I gave them a medication to strengthen the barrier against that emotion that they're not even feeling?
uh,
Hypothetical.
yeah,
Well, the hypothetical became real because I had these patients who were not doing well.
yeah.
Let's try an antidepressant. And, getting
Uh,
back to that man with the Holocaust survivor, I suggested it. He left angrily.
yeah.
Um, 3 months later, he came back. I have no choice. I keep on having these attacks. We tried the
Mm,
antidepressant. It worked.
yeah.
Stayed on the antidepressant, no more attacks. And I've recently published an article, a series of patients. The response rate to an antidepressant for those who were given an antidepressant, 90% were cured, not cured, but
Wow.
relieved of having these attacks. They had to stay on the medication, but
Right.
for the first time in years, no more attacks, and they could live their life not fearing when is the next attack going to happen. So
Right.
it also confirms a mind-body origin to it. And there are other conditions where the medical treatment just is not optimal. They have a chance of healing, except that nobody ever suggested there's a mind-body relationship, which is the first step. Um, where nothing else helps, an antidepressant can be very helpful in any number of conditions. But the irony and the catch 22 is there's very little research using antidepressants.
Yeah.
Who are the patients who would volunteer to be in a study of antidepressants would be people who are depressed and are anxious.
Yeah.
What about the people who aren't?
Yeah.
They're not going to be interested in being in a study.
Right.
I had to learn how to talk to patients, and I
Mm,
give them the understanding, and I no longer prescribe it. I basically give them the option.
yeah.
Consider that as an option. If you're still not doing well,
Yeah.
give it a try. If it doesn't work, or if it has side effects, you can always stop it. The
Yeah.
choice will be yours.
Right.
And it
Right.
really had a dramatic effect. Patients stopped walking away angry. And
Yeah.
in fact, most of them, please, can I try it? And
Yeah.
again, if it doesn't work, if there's side effects, they can stop it. Now, that's not healing, but
Yeah.
it is relieving
Right.
a medical condition that they've been suffering with for years, and
Yeah.
now they feel better. And studies are needed. And the problem is to get patients who are not depressed or anxious to take part in those studies because that's where it has its value.
Right.
So it's a whole mixture there. And
Yeah.
the other thing, and I'll emphasize this because it's
Yeah.
important, that barrier, we, in treating, I can't rush to say, let's knock down that barrier because that barrier may still be necessary.
Yeah.
And although repressing is not a great option, it's the best that they have that protected them for so many years.
Right.
Um, and I introduce the understanding, I reassure them, but I don't push them to go into psychotherapy and
Yeah.
pursue this.
Yeah.
I have to see their reaction first. And that's one of the purposes in the book because almost everybody
Yeah.
sees themselves in that book and it
Yeah.
just creates the understanding and opens the door.
Yeah. That's the first step, understanding. I love how you use that. You use that word many times. Understanding, so powerful. Because once we understand something, then we lose the fear of it. It's a great antidote to fear. I guess why I had to talk about spirituality in the fundamental, let's say, understanding about what spirituality is that even with the Holocaust, for example, if Hitler he had some understanding of spirituality, the foundation, then that wouldn't have never happened. I mean, I'm just of course it happened and then we can't deny or kind of talk about it in a different way. It's all about healing now. What can we do now? But I love the big picture of life, of the human experience. So how can we go back to fundamentals? And I understand that the body mind complex will do what it does, and it's limited in so many ways. And we'll need the help of science, of course. And to me, for emergencies, that's the best thing in town. But when it comes to living a healthy life, a happier life, peaceful life, affecting one another in a kind way, in a loving ways to avoid unnecessary suffering, I have to go back to spirituality. To me, it's like the has been without any dogmas. It's just a very basic understanding. Once I know that everything's connected, why would I cause any harm to somebody else? There is something about seeing, let's say, God everywhere that it changed the way we behave. It changed. It seems like it changed the body's chemistry even. I feel happier most of the time and less anxious. There's more peace within my day-to-day living, which avoids disease. Speaking of disease and problems like that. So yes,
Two thoughts.
yeah, yes.
One is, does spirituality lead us to love and kindness, or does love and kindness lead us to spirituality?
Yeah, that's a very good question. I would say, yeah, it's both ways.
Yeah.
Yeah.
The other thought was, and you brought up Hitler, so I'll follow up
Yeah.
on that,
Yes. Yeah.
is in dealing with the concept of repression, I think there are two types of repression. One is successful repression, and one is failed repression.
Oh, wow.
So a guy like Hitler
Yeah.
was driven by anger.
Yeah.
The anger was a result of childhood
Yeah.
and repressed anger.
Yeah.
What I call failed repression is he's acting out of anger, but
Yeah.
has no
Mm,
awareness that that anger is a product of his being mistreated as a child.
right. Right.
And I would invite anybody here to
Mm,
Google and look
yeah.
for a picture of Vladimir Putin as a child,
Yeah.
and you will see a picture of one of the
Mm,
saddest little boys you've ever met in your life.
wow.
And
Yeah.
here it's failed repression because look at what he's doing.
Right.
And that's
Right.
where psychotherapy, if somebody's angry and why are they angry, maybe they can get at the cause of it. But at least the
Yeah.
anger today
Yeah.
is a red flag that, hey, why is this person angry? And it relates to earlier stuff.
Yeah.
I'm talking about successful repression. Well, and many patients who are repressing are lovely people. They're not,
Yeah.
they should be angry, of course.
Yes.
They're
Right.
not angry
Yeah.
and they're lovely people.
Huh.
And
Yeah.
It's interesting. One of the first things before I even knew what repression was, I noticed that there's a condition called malignant essential hypertension, meaning people who
Uh,
have sky high blood pressure, resistant to multiple medications,
yeah.
and the majority of them in medicine, we don't know what causes it.
Right.
I noticed before I had any psychological awareness of any of this, I noticed that those patients,
Mm,
remarkably, every one of them was one of the
mm,
nicest people I ever met.
mm. Yeah.
And
Yeah.
they're not angry, they're not depressed, and their pressure is sky high. And that was actually the first sign that I saw
Yeah.
about repressed emotion. And uh, particularly in the Black population, there is a lot of that severe hypertension.
Uh,
And a lot of them had horrendous stories, and they're fine.
yeah.
So
Yeah.
it, repression can still allow that kindness.
Yeah.
So
Mm.
it's murky. But
Wow. It is. And I love the way you said that it's the other way. Spirituality leads to loving kindness, and loving kindness leads to spirituality, this fundamental understanding that everything's connected. So, loving kindness in this case would be loving oneself and going deeper to understand what's happening here, like within the body mind complex. So, that would be the very beginning, I would say, because that was my first person experience, kind of listening to the feelings, the emotions. To this day, I'm very, very careful, and I'm always very kind with my own self, and that's why it's easier kind of to be kind to others. So another question that I had here, I know you mentioned briefly. I'd like to ask you again. We're almost at the end and have so many notes here too. So just to clarify for the listeners, the difference between repression and suppression. So yeah, that's a question that I wanted to ask earlier.
right, a lot of people confuse the terms, and I
Yeah.
find them in the book. And I'll give an example that explains the difference. So when we are suffering from emotional distress, uh, there are three terms that are used that are often confused: suppression, repression, and denial.
Denial too.
So I'm going to give an example, and through that example, define those three.
Yeah.
Not everybody agrees on the definition of repression. Some psychologists think it's not unconscious, but I most would agree it is unconscious. So let's say you have a man who has been not feeling well, and he goes to the doctor and he's given a diagnosis of cancer. And it's a bad cancer. You've got 2 months to live. We don't have any treatment that can prevent it. So how does one handle it? Suppression. You're
Mhm.
aware, oh, this is terrible. I'm going to die. It's awful. I have limited time left. I don't want to spend all my time suffering from the distress. I want to be in touch with my love for my family. I want to take care of my affairs. I want to think of other things and not dwell on it all day.
Yeah.
That's suppression. And that's
Wow.
part of resilience, the
Yeah.
ability to, all right, I'm not going to let it paralyze me. I'm going to do this. I'm going to do that. Um, Denial is unconscious. So this man who was just diagnosed with cancer, he's not upset.
Yeah.
Why isn't he upset? Denial. Well, he's not upset because he knows the doctors are wrong.
Uh,
I
yeah.
don't have cancer, so why would I be upset?
Right.
Now he's denying reality. And that's also at an
Mm.
unconscious level. He has no evidence to support his opinion, but
Right.
he's sure their doctors are wrong, which a lot of people are anyway. But
Yeah. True.
um, that's denial. Repression is, all right, I've been diagnosed with cancer. I'm going to die in 2 months. How are you feeling?
Mm.
Oh, I feel fine.
Mm.
I'm not upset. That's
Yeah.
repression, where
Yeah.
your unconscious mind, you're not struggling to keep it out of mind. You're not focusing on other things. Yeah, I'm not upset.
Right.
I don't know why I'm not upset, but I'm not upset
Mm.
about it.
Right.
That's repression.
Right. I don't know why. Yes. Right.
Yeah.
Um, wow. So that's very clear. Yeah, the difference between them. I needed to know to hear this for myself too. Um, Thank you so much, Dr. Sam, for everything that you have done. I mean, you're doing. It's just so beautiful. And from my perspective, it is highly spiritual. You connecting with your patients at a very deeper level. It's a very human level. By being so human, we ended up finding our spirituality because that's what connects us.
Yeah.
Unfortunately, suffering really brings that sense of
Yeah.
spirituality to the
Yeah.
surface.
Two last points.
Yeah.
One, the power of music
Uh,
and getting in touch. Um,
yeah.
and it doesn't matter what kind of music, if it's moving, it helps.
Yeah.
The other thing is,
Yeah. Mm,
just one example, grief.
yeah.
Somebody has died, we are grieving.
Yeah.
And sometimes we suppress and focus on other things and do what we have to do, and
Yeah.
that helps get us through the day.
Yeah.
There's sometimes during the process of grief that you're going around, you're having a great time, you're happy, you see your friends, you're doing this, and you feel very happy, and you
Yeah.
say to yourself, boy, I can't believe how good I feel when this has just happened.
Yeah.
And that is a part of the
Mm,
grieving process that helps protect us. You can't grieve and grieve and grieve and grieve without a break. And repression gives us a break. And it doesn't mean we're never going to deal with it. It means it gives us a break and it helps us in our resilience and it helps us through our grief.
right. Wow, it's incredible how the system works, right? It's always protecting, and in so many ways we see that the body mind kind of connection, and them together, kind of trying to protect us in so many ways. That it's fascinating to me how that works. Um, and I wanted to ask you a few more questions. The ending. I have an ending question for you. But before that, would you like to add anything else that you left unsaid or read a passage in your book if you have that in front of you?
Um, no, I think that's pretty much it. And, I just want to emphasize my final paragraph in the book. And it is my hope that the observations chronicled in this book and data that support these observations will help stimulate awareness, interest, and research in this area. I also hope some readers will recognize from the stories of my patients parallels in their own lives and recognize the role repression has played in their life or in the life of someone close to them.
Yes.
I believe this understanding can open the door to awareness and to trusting the wisdom of our unconscious mind,
Mm,
that in allowing those emotions into awareness, it is opening the door to healing. Understanding the role of repressed emotions in medical illness constitutes a frontier that we have not yet even begun to explore.
mm,
It is time to begin that journey.
yes, absolutely. I'll have the link of your book, Amazon link, on this podcast notes. And I wanted to thank you again for your beautiful work and going deeper to help humanity to heal. That's something that's very close to my heart for some reason, obvious reason. So, but before we say goodbye for today, Sam, I have this ending question. What three experiences you wish everyone to have before they lose the body, before they die?
Experience of love,
Yeah,
the experience of connectedness,
yeah.
the experience of gratitude.
Mm, yes, it goes back to spirituality, doesn't it? They are part of that understanding, yeah, that deep understanding of the reality, essential reality. Thank you so much again for your presence. And where's the best place to find more information about you? Would that be your website, or are you on social media, Facebook, Twitter, or other?
The website, which I am in the process of redoing because I've been too busy and
Yeah.
I'm going to do that. If you Google my name, it gives links to some of my articles that I've published. Um, And I would say on a completely different subject, my second book, Hypertension in You, is a pure medical book on how to treat hypertension that optimizes the pharmacologic treatment of hypertension. It's not a mind body book, but it's the best book out there on how to individualize the pharmacologic treatment of hypertension and get a normal blood pressure without side effects and prolong your life.
Yeah.
Um, but I guess the website, which I will be working on, um,
Yes.
yeah,
But for now, your website, would that be drsamuelmann.com? I have this
yes,
one here. Okay, so I'll list this one for now.
yeah.
Thank you so much again for your presence in our reality, Dr. Sam. Thank you.
Thank
We'll
you. My
talk soon.
pleasure. Thank you
Yeah,
for inviting me.
thank you.